I'm Wasim Raja, final year medical student from OIMU.
Wesley, final year medical student, OIMU.
Hi, I'm Halin Akash, final year medical student from OIMU.
Muhammad Akram Rumi, final year medical student, OIMU.
I am Abdul Basit, final year medical student, OIMU.
I am Rekha Sarbaraj, final year student from OIMU. Today we are going to show you how to handle a patient in traumatology. In traumatology, first we have to do primary survey of the patient. Primary survey, it is the first rapid assessment to treat the life-threatening condition of a patient. It follows ABCDE protocol.
In ABCDE protocol, now I am going to explain about airway. First, we want to secure the patient's cervical spine. After that, we see any obstruction in airway. After, we checking any abnormalities like secretion of saliva, blood. After that, is there is any presence of foreign particles. After that, is there is any external or internal bleeding. If patient needed, we want to do endotracheal intubation.
In ABCD protocol, now we are going to see breathing. In breathing, first of all, you have to check patient respiratory rate, oxygen saturation, and chest movement. And if the patient was in critical condition, we have to give oxygen. And also we have to check if patient have any abnormal sound. And now we have to check if the patient have any life-threatening condition like tension pneumothorax, open pneumothorax, and massive hemothorax. Thank you.
So now I am going to do circulation in traumatology. What is circulation? To prevent shock and maintain blood flow. So firstly, we have to check patient's pulse and patient's skin color and blood pressure and capillary refill. So what is capillary refill? We have to press patient's nail plate for more than 5 to 10 seconds and release and observe number of seconds it take it for return blood flow. It's less than 2 seconds, it's normal, but it's more than 2 seconds, it's completely abnormal. And secondly, we have to check any external bleeding is there or not. If any external bleeding is there, we have to stop. We have to apply direct pressure, like take a cloth and tie over the bleeding. And thirdly, insert 2 large bore IV fluids and give IV fluids like normal saline or Ranger lactates. And fourthly, we have to check any internal bleeding is there or not and keep the patients with warm temperature and monitor patient's vital signs like any hemorrhage, any shock are there, any bleeding injuries are there or not, and urine output, and keep the patient in a warm temperature. Thank you.
So in ABCD, now we are going to see about D, which is disability. First, we have to see the assessment of rapid neurological signs. Like, for example, check is the GCS score, which is Glasgow Coma Scale score, by checking motor and sensory responses. Okay, by checking the sensory response, which is the eye, we have to check. There is no response of eye. Now we are going to check the motor functions, like the movement of limbs. Move the hand. There is no response. So first we check the sensory responses. Now we are going to check the motor responses. Now we are going to ask the patient to move the hand. Move the hand. There is no response. So that means the motor response is also not responding. So now we have to check either if there is a head injury or spinal injury. There is no head and spinal injury has been. And at last, we have to check if the patient is hypoglycemia, which is the level of glucose. And that's it. Thank you.
In ABCDE protocol, now I am going to explain about E. E stands for exposure or environmental control. In exposure, we have to expose the patient completely by removing their clothes and check for any abnormalities, check for any internal bleeding, check for any penetrating injuries, and then check the back of the patient, inspect the patient from the head to toe so that we can find any abnormalities. In trauma, the patient loses heat fast, so they will lead to hypothermia. and it will worsen shock and it make coagulopathy. To prevent hypothermia, give warm blankets to the patient, give warm IV fluids, then make the room warm, and if there is any wet cloths, then remove that. Thank you.